Hi, I'm Kevin with Acteon. This is just a quick tutorial on the proper positioning of PSPIX plates in our holders as well as in the machine and the patient's mouth. So when you purchase one of our phosphorus plate systems, the PSPIX, you're going to get some phosphorus plates. You're also going to get a bunch of bags with plate holders in them. So you're going to find that the plates themselves have two sides. One is blue, one is black with the logo. The blue side is the side that is exposed. This is the side that faces the radiation, and this is the side that collects all of the data. This is the important side. The bags themselves, as well as the paper, also have two sides. So with the paper, you'll notice a logo and a blue side, right? Just as the plate had a logo and a blue side, so does the paper. No coincidence. The bag has a clear side and a black side. So for proper positioning, you're going to want to put the plates into the paper holder so that logo orientates with logo, blue orientates with blue. You'll also notice that there is a P and a P on both of these, so they should also be facing the same direction. Once you've put them into here, you will slide it into the bag so that you can see the Acteon logo, which means that on the other side, you should have black and blue all facing the same direction. So go ahead and push it all the way into the bag, right? You're going to peel off this little piece here, which allows you to seal the bag completely. As far as putting this into the patient's mouth, the logo always should face the patient's tongue. So what I mean by that is, hypothetically, let's just say we're doing the anterior, it should be orientated like this. Sorry. Like this. The logo facing the patient's tongue, because the black side is the exposure side, right? This is the side that's going to absorb the radiation. So you want this side always facing out, always facing towards your radiation source, right? So if you're doing posterior, right? If you're doing anterior, or however you're orientating, or however you're getting your exam done. So remember, blue, or in this case black, is exposure side. If you see the Acteon logo, and if that is facing you when it's in the patient's mouth, it's wrong, okay? We want the exposure side always facing towards your source of radiation. Now, once you're done, and this has had, your radiation has been captured, and this has been exposed, you're ready to put it into the PSPIX. Easily done by pulling off the bottom part. This is what we just glued. And we're just going to push the plate out of the plastic so that it's just sort of hanging out. And we want to pull the plate and the paper out together, right? This is now trash. We'll discard this. We now have the plate in here protected by the paper. So we're holding it so that it's not getting any exposure from any lights. It's not gonna be touching anything. We'll then drop it into the machine. The machine is currently off, but the screen would be facing you, and you want the logo also facing you. So you would simply drop it in like so, and as you let go of the paper, right, the paper will expand or pull apart, and that plate will slide through. So the plate will slide all the way through, it'll scan, and then it'll wipe, and it'll come out of the bottom. So the blue side of the plate should never be facing you when you're scanning it into the machine. So scan like so. Now, if you're doing let's just say a full mouse series, maybe 18 images, my advice would be to, first off, to make it easiest, have 18 plates, right? Make sure you have a plate for everything that you're doing so that you don't have to go to the machine and come back and go back and forth. I find that what's most commonly done is somebody will have the tray, their tray, so they'll take the paper on the tray and simply write 1 through 18. They'll then place one plate on top of every number. As they scan, they'll put the plate in, they'll take the image, they'll put the plate back onto the number upside down. This way, as they move along, they know which they've scanned and then which have to be scanned as well. At that point in time, once you've gotten all of your plates exposed, you will bring them to the PSPIX, right? And you will take them off in the same order. So this way, it fills your template in the correct order in which you took the exams. So that's a general guide to orientating the plate, orientating it in the patient's mouth, as well as how to place it into the machine itself, and just a good practice on how to be organized for when you're taking your exam. So if you have any questions, feel free to reach out to your local Acteon rep. But if you have any questions for me in Florida or the Caribbean, give me a call. Thanks.